Let's go.
Welcome to The Integrative Edge, your go-to podcast for fresh perspectives on holistic health and functional movement. Join us as we explore innovative ways to optimize your health naturally and sustainably.
I'm Kelly Demers, founder of the Integrative Wellness Coalition and the owner of True North Performance.
I'm Lindsay Seefeld, doctor of physical therapy and owner and operator of Uplifted Oncology Rehab.
I'm Dr. Kimberly Klimek, licensed pharmacist and owner of Innate Healing and Performance.
You can find the show on Spotify, Apple Podcasts, or wherever you get your podcasts. Subscribe so you never miss an episode.
Welcome back to the Integrative Edge, your podcast where we explore innovative ways to optimize your health naturally and sustainably. I'm your host, Kelly Demers. As always, I'm joined by my two amazing co-hosts, Dr. Lindsay Seefeld and Dr. Kim Klimek. Ladies, great to be back with you. Today, we are digging into a big one, gut motility, including the often frustrating and confusing worlds of IBS-C, which is constipation dominant, and IBS-D, which is diarrhea dominant. So many people are dealing with this silently with gut issues, and they don't just impact digestion. It's also impacting mood and immunity and even pain levels. Kim, let's start with the basics. What exactly is gut motility and why is it so critical to our overall health?
Yeah, so our body has a digestion process, and it's sort of this little synchronous process that happens. So it starts in the beginning when you're chewing food, which stimulates your body to release digestive enzymes, which then help your body release bile. Well, I should say you have to have enough stomach acid first, which then triggers your liver to release bile. And then the digestive enzymes and the bile work together to help move food and stool through the digestive tract. And that's kind of how the process happens. And then oftentimes that term is also called peristalsis. So the movement of the stool and the food through the digestive tract. Another term might be called motility, right? So these kind of the peristalsis and the motility disorders for people can include those symptoms of constipation or loose stools, alternating loose stools.
All right. So let's build on that a little bit. Let's zoom in a little bit more. How do you differentiate between IBS-C and IBS-D when you're working with clients, and what are some of the most common underlying causes that you see?
Yeah, so IBS, so I would say in general, IBS is really just a blanket statement in the conventional space. It's really just a term they use when they don't really know what's going on. But if you tend to, because people can actually fluctuate with both. They can have constipation or loose stools, or they can be primarily constipation, which for most people, they get told that it's normal to not have bowel movements for multiple days in a row, which I fully disagree with. And I was told that also when I was younger, and now I learned that it's just it may be common, but it's not normal. Okay, normal is having a good bowel movement at least once a day. That's comfortable, regular. You feel like you're fully emptying, and then on the reverse spectrum. And again, so some people may not have bowel movements. Sometimes clients will say they don't have bowel movements, maybe every 3 days, maybe every 5 or 7. That's just definitely not normal, because one of our primary methods for removing and eliminating waste and toxins from the body is having bowel movements. We talk about sweating, but bowel movements are so important in that aspect. And then on the reverse spectrum, some people always they would say, well, I'd rather have loose stools than constipation. I don't know. Both of them are not fun, especially coming from someone who has and we could talk a little bit about that, but I'm in my own medical journey, but I struggle with constipation all when I was younger in college. And so on the opposite spectrum, if you're having loose stools, right, multiple non-formed stools, watery loose stools, that can lead to malabsorption. So you're not really absorbing all your minerals and nutrients because they're going way too fast through your body. So they don't have that time to actually get absorbed by your intestines in the right amount of time. So that can also be harmful for people. But yeah, loose stools And again, that dehydrates you. There's a larger loss of electrolytes, that kind of stuff as well. And that's more like some people, it's very prominent, right? Where all of a sudden it just comes out of nowhere because they might acquire like an infection or a virus or something like that, right? Like we think of whatever the norovirus that went around this winter. It was largely linked to just an onset of loose stools for people. So it's a disruption in their microbiome, and it's a disruption in the balance of their good bacteria and their bad bacteria. So that can be often linked to the term dysbiosis.
Awesome. Dr. Lindsay, let's talk shit. I want to bring you in here. When someone's struggling with constant constipation, and I've been waiting to say that. I mean, like this is a big deal for me. This is my moment to shine. That statement. When someone's dealing with chronic constipation or loose stools, how can physical therapy, movement play a role?
Yeah, I mean,
take us down
it
that rabbit
definitely
hole?
can be, obviously we're going to touch upon the different avenues why you're either constipated or have diarrhea, but you have to think about like, is there some kind of medical underlying mechanical type issue going on? And I always like to dive in deep when somebody is coming to me and having some, constipation and diarrhea type issues. If they're coming to me with constipation, let's start with that. Okay, is there something mechanically going on that's like maybe limiting the flow of that stool? Why is it getting caught? One thing I always ask, like number one thing when someone comes to me with this issue, okay, tell me about your past surgical history. And why do I ask that? Well, if you think about it, all these different surgeries that someone may have, like C-section, appendectomy, gallbladder removed, hernia repair, all of this can create scar tissue. And scar tissue will basically hold that digestive tract, and it won't allow for that nice, beautiful flow of the poop, essentially. And so we have to figure out ways to help decide how to release it or how to work on releasing it. And that's definitely one thing that I'm trained on. I do a lot of what we call visceral mobilization. So, I'm working with the internal organs to help free it and teach you on how to free it as well. Because, as we've talked in previous episodes, if that organ is not moving like it should, it's not doing its normal function. For example, let's go to the gallbladder. If you had your gallbladder removed, well, obviously now we're not having that bile, right. But think of the scar tissue near your liver. And so if your liver is stuck, you're not doing a lot of natural processes there as well. So it's very important to look at your past surgical history and figure out how to help it move. Other things too that, medically wise that I consider is, do you have some kind of neurological condition, muscular sclerosis, Parkinson's, have you had a stroke? Because all of our gut is highly neurological. There's a lot of nerves that are going into our gut. And if you already have a condition where the nerves are just not, functioning as optimally, it can really slow things down as well. Also the other things too, pregnancy is another one. Being pregnant, there's a lot of pressure in that gut system too. So that will really slow things down as well. And, kind of moving towards the opposite spectrum where you're having more of loose stools, a lot, especially the patients coming in to see me are going through some kind of oncology journey. Well, that in itself changes the whole gut microbiome and things, you're not absorbing things like you should. And so, it's try to strategizing with them ways we can kind of, help slow down their system and support their system. And, obviously reach out to someone like him to kind of help support their body, while they're going through that journey. But, definitely there's a lot of physical things that could be going on in the outside of your body that is affecting the inside. Mm-hmm.
Yeah, you hit on it there a little bit too. It's like the medication induced, like IBD or IBS-C,
Yep.
which is totally a thing, right? You can literally have medications that affect your signaling to your brain, which can slow down your digestive tract as well. So chemo is definitely a very important one to be aware of. And then it's like, I think of things like a lot of patients are on like proton pump inhibitors like omeprazole, pantoprazole, which basically slows all your natural stomach. Like you need stomach acid, again, to help trigger the release of bile, which helps move food through the digestive system synchronously. And then the other ones I think of is like there's a lot of patients who may be on like SSRIs or SNRIs, which affect your neurotransmitter like signaling to your brain. Like oral contraceptives really mess with the microbiome and disrupt it. So all those things can lead to irregularities in bowel movements.
So let's dig into that a little bit more. Let's talk strategy. If somebody's dealing with IBS-C or slow motility, what are some of the foundational nutrition or lifestyle shifts that they can try?
Yeah, I think it's important that we I wanted Lindsay to go over so what is it like we have that stool chart in the doctor's office or whatever, and it's like here's how you can tell if like you're probably struggling with constipation.
Lindsay,
right? Okay, yes. I use this chart.
It's like first identify what it might look
like. Yeah. So I pull out this chart with like every patient that has poop issues, and so it's called the Bristol Stool Scale, and basically there are 7 different levels of like your stool and what it should look like.
Periodic table, but with
it is. Yes, it is. So type 1 is considered, we're in the constipation zone. So it's very separate and very hard. So you're getting like those hard little pellets. And then type 2.
They call them the rabbit turd.
Rabbit turds.
That's what the patients say.
Yep.
And then type 2 is where it's very hard and lumpy. So it is together, but it's very lumpy and it can be sausage-like. Type 3 and type 4 are really where we optimally want to be. We're going to get more of, type 3 is more of like a sausage, but we'll have like little cracks, little bumps, which is normal. And then type 4 is it's smooth like a sausage. And then we're getting kind of more into the diarrhea zone. So type 5 it's more of like separate blobs. Number 6 is mushy, and number 7 is just complete water. And so, Kim had mentioned you can fluctuate between all of these. It's not abnormal, but, ideally you want to be kind of around that, type 3, type 4, where it's, you want it soft and smooth and long. And looking at the color too, I always ask about the color, like you want your poop to be like a brown color. If it's different shades of yellow and greens, that could indicate that there's, you're either not absorbing things like you should be, or we're releasing too much of something in your body.
Is color an indicator of when someone should seek help?
I think it's definitely if you're consistently seeing this, obviously if you're starting to see like red, like if you're pooping blood,
right.
That's an emergent thing. You need to get that checked out ASAP. But I mean, obviously, we eat something like we shouldn't, and then all of a sudden our poop is a different color. Right. But, I think if you're consistently kind of seeing like, gosh, like I'm always seeing, kind of, like this like green color in my stool, what does that mean? And then it's definitely worth tapping in and trying to figure out what's going on.
Yeah, we had a podcast listener submit a question, which is great. Like we encourage you to submit like your questions or topics that you're interested in. But they said, I would love to hear about your thoughts on gut motility disorders such as IBS-Constipation, particularly functional constipation, etc., and if those have changed much since you started working as a functional medicine practitioner. And interestingly, this was like someone I knew from years back when I was struggling on my own medical journey. So I told you guys like more in college, I struggled with like extreme constipation. So for me, I was told that it was normal, but I wasn't having a bowel movement for like every 7 days. I don't think I really like noticed it until I pinpoint, like I always kind of like knew I struggled with constipation, but then when you sat down and actually like counted out the days, I'm like, oh wow, yeah, like that's a long time. And then when you would tell somebody that, they're like, that's not normal, right. Even though the doctor said that's normal. Hopefully it can try to save a lot of people from going around the merry-go-round of conventional medicine, because the strategies that they use for constipation are just, for lack of a better word, garbage. They are always trying to give you a lot of like stimulating products or like like Dulcolax or like stool softeners or like Miralax, right? And there's a lot, you can read a lot of research on how chronic use of Miralax can really damage your nerves and like your bladder and other things in your body. And like long-term chronic use of that is not good for the body. But it's always this large, like, focus on stimulating the bowels to do this. And again, everything I've learned about functional medicine is just like your body can do these things on its own, but what's the root cause of why? So going back to what we just talked about in the beginning of the episode about how the process works from the beginning. So I started looking at things. I came to understand that like chronic constipation can be linked to the disruption of bile flow, which comes from, again, liver health. So even when we're having, like, literally when you start having gallbladder issues, it's a big old red flag that you got liver congestion going on, okay? Like you got liver issues going on. I don't know if you got fatty liver, more liver congestion. Your bile flow is disrupted, and that's why you're starting to experience slower bowel movements. And then again, maybe digestion. So maybe you're low in digestive enzymes, okay? Are you not actually, like this is totally a part of my journey. I was like always on the go, like trying to shovel in food. Like it was like a chore for me to eat my meals, breakfast, lunch, whatever it was, because I was in grad school and undergrad and you're just go. And it's just like, okay, I just got to eat to like sustain and then keep going. But we didn't actually like stop, let your body understand that it's time to eat. Chew your food 20 to 30 times before you actually swallow it. Like let your body know that it's mealtime so it can release those digestive enzymes, so it can produce enough stomach acid. If you got heartburn, acid reflux, indigestion, we absolutely have something going on in your stomach. And that's, just further functional medicine things we're looking into to eradicate these different types of infections. But I actually learned over the years in my own personal experiences, because let me tell you, I went down the rabbit hole with every possible like conventional strategy for testing. I had EGDs, so tubes down my throat, tubes up my butt. I had the small bowel x-rays, these colon studies, motility studies. That was kind of like the next higher up that I got like referred to. And I was going through all this in my early 20s. And then, I ended up getting like a referral to like Cleveland Clinic and these just higher like gastroenterology systems. My story is really unique in a sense that I ended up, acquiring a really bad infection when I went to Costa Rica studying abroad in my undergrad. And that's not necessarily, it's a piece of the puzzle for sure, but I was already struggling with constipation like very severely before all that stuff happened. So it basically just amplified it. But what I learned is that you actually need to support the liver. You need to start cleansing the liver and opening up that pathway and opening up and helping support your bile flow, and that will help you with chronic constipation. So things I have a little, even a little checklist for people. Like, here's all the strategies you can do, right? First and foremost, I just tell them you got to start eating some liver-loving foods. Nobody even thinks about this. Like when I'm younger, nobody's telling me to eat things that are, their liver-loving foods are actually just bitter foods. And again, what does it do? It stimulates your digestive enzymes. So it's like you get this little bitter food on your tongue, and it's like, it's a signal to like your systems to release the digestive enzymes. So eating things like arugula, dandelion greens, radishes, beets are like the powerhouse for the liver. So I always just tell people, I don't care how you get them in, but you need to start eating some beets. They're not only good for like nitric oxide production, blood pressure regulation, and liver cleansing. So I'll buy like cooked and peeled beets, because I ain't going to do all the work, but I'll put them in my smoothies. It's just a lot of work, right? Kudos to you if you're going to grow your own beets and then cook them and do all that jazz. But right, we are a busy society. So I put them in smoothies, or I'll just put them on like a salad, or I'll just eat like a pickled beet on the side. Like there probably isn't like 5 to 7 days out of the week for sure I'm having some form of beets. I have organic beetroot powder I put in smoothies. You can buy, probably one of the cheapest supplements is beetroot capsules. Take those twice a day with meals, maybe 3 times a day with meals if you got blood pressure issues or things like that. But it's going to start opening up your liver and start cleansing it. Milk thistle is a really good herb and supplement that helps cleanse the liver. But eating those foods on a consistent basis, right? It's not just going to happen overnight. Other tools I've used with people is, I've done a lot of promotion for a professional grade product. It's an actual phase 2 and phase 3 upregulation of that elimination process in your liver. It's called Core Restore from Orthomolecular. Absolutely love the product. I don't think there's a single person that and I use that actually to help flush out a lot of bad estrogens for people who have estrogen dominance too. That will help open up your liver and start producing more bile. But there isn't a single person who's used that product. I think it's a nice little 7-day liver flush. Lots of benefits. One of the primary things people tell me from it, oh my gosh, I had way more bowel movements this week than I normally do, but they were good. And cause it's got prebiotics and all these other good, beneficial, professional grade herbs and stuff in there that help the liver. Cause there's an herbal capsule too, that's basically packed with stuff for the liver. Because again, that's what is going to help with constipation. And then I've gone to, if people are really backed up, people will talk about coffee enemas, right? That's a thing. I don't think you have to even get to that point unless you're trying these strategies first. I have used something called celery juicing with people. You can get on the Instagram and there's a whole community about celery juicing. I don't think long-term juicing is really good for people. I'll just say that. But if you're doing that on every day, all day, you're going to probably deplete your body of minerals, nutrients, probably spiking your blood sugar. So be mindful. It's a tool to use. And if you're really kind of backed up, I tell people you can kind of do some celery juicing for about maybe a week or 2 weeks to really just cleanse out your liver. You're going to release a lot of bile and junk and stuff that's really been bogged up in the liver. So you kind of start out with, the way you do that too is I tell people start out with, in the morning you wake up and do 4 to 6 ounces of a plain glass of lemon water with a little salt, right? Get a little bit of electrolytes going, and then wait 15 minutes and then drink you can start off slow, anywhere from 4 to 8 ounces of plain juiced celery. Okay. It has to be completely plain juiced celery. Does not taste good. Take a straw and drink it. I've done this. Trust me, I've done it and it works. I don't care if there's a scientific study. I've had a lot of people tell me it works. And again, our main point is really just to kind of clear out some gunk so the liver can get functioning again. But you can drink that 4 to 6 to 8 ounces of plain glass of celery juice and then wait another 15 minutes and then begin to eat your food. And again, that's going to stimulate digestion. And then maybe an hour or 2 hours later, you're going to notice that you're having a bowel movement or you're clearing some things out. Okay. And make sure you drink electrolytes after that to make sure that you replenish, because some people have loose stools from it. And again, it may just be that you're cleansing some things out from the liver, but it's a good tool. And I've used that on occasions if you get backed up or things like that. But then focus on doing things regularly that I said that support the liver and cleansing of the liver. Because there's one other component too, is if people tend to struggle a lot with that constipation and just more right upper quadrant congestion, that can also be a sign too that there's just more toxin buildup in the liver. And in my own particular case and journey, it was something I had discovered when I had candida overgrowth in my gut, mold toxicity exposure from being exposed, actually numerous occasions where I was exposed to kind of different mold spores, and my parents had a water damaged home. So it was just that was the root cause. So why did I have all this constipation? Those kind of things. But those are definitely the strategies that I use. And there's a better supplement too for bile support, is something called TUDCA. So I've used that for people if they're really just really bogged up, and because that's the first and foremost thing you want to start. Anything I do in my practice, you have to be having bowel movements first. I can't go in and kind of kill off things and work with antimicrobials and do anything if you got parasites or whatever, these things that we talk about, in the gut health world. You can't even do any of that stuff unless you're having bowel movements first, because we have to have a way to eliminate the toxins from the body.
Can you talk about the role of, I'm hearing celery juice and I'm I don't know where I would get that. And I don't know that I would juice it myself.
I say that lightly too, because there's kind of I would say there's some extreme stuff out there on Instagram and whatever, just the other functional medicine things. Yeah. It's terrible. There's this one guy too. His name's the medical medium, and he's very extreme. He's don't eat eggs, don't eat this, you got. EBV and all this stuff. And I'm like, this is harmful too. Like, don't deplete your body of all these things. See it as a tool and it's a strategy to use for a little bit. And if it helps kickstart your journey, like that's the whole goal of it. But you don't need to be like super like depleting
if you're experiencing some maybe mild constipation and maybe it's not full on, IBS-C, but you notice that, you're not super regular from time to time. Can you talk about, either of you, talk about the role of magnesium in getting things moving?
Yeah, for sure. I mean, magnesium time and time again, responsible for over 400 different enzymatic functions in the body. And if you're deficient, like most people are, there's lots of different forms of magnesium. One that's going to help more particular with constipation is using like magnesium citrate capsules. Okay. That's going to be the magnesium citrate capsules. I don't encourage you to go and buy the magnesium citrate in the bottle over the counter. It's very harsh. It's going to produce probably a lot of cramping and pain for you. So you just want to be more gentle approach on the body, but you can use like usually 2 capsules twice a day with meals, and that can kind of help you. Like glycinate helps relax the body, relax the muscles, right? So that can be also a tool if you're just feeling like chronically stressed. And like Lindsay said, like there has to be energy flow and just relaxation and movement for your body to allow like stool to go through.
For sure. From a movement perspective, diaphragmatic breathing, breath work is such a powerful and, again, underrated tool to use, but that deep belly breathing stimulates the vagus nerve. It can help regulate motility as well. Lindsay, would you add?
Actually, that's great that you brought up the vagus nerve, because there is such a brain-gut connection. There is an actual connection between your brain and your gut. So if you think about it, like, what happens when you're really nervous, right? You get the butterflies in the stomach, right? Or when you're scared, it's like you clench in the gut. So it is a thing. There is a brain-gut connection. And, actually it proposed me to think about a patient that I had worked with, several years ago. And she suffered from pretty traumatic abuse when she was younger, but she always dealt with this constipation issue. And it was like, you could do all the physical things, like she was doing all the medical things she was doing, she was a good exerciser. We were working on gut mobility and all that kind of stuff. But it was, she had to heal her mind, because no matter how much work we did, if she couldn't clear that mind, that gut is constantly going to be shut off. It's going to be tight. And people would present like that, especially in the physical therapy world too, like, chronic back pain, and people just like, they don't even share the fact that they're constipated or have digestive issues, I've just got this chronic back pain that's been on here for years. And, as a normal physical therapist, probably in my young years, I'm like, oh, it must be mechanical. It must be something going on here. But it's like, now that I'm older and wiser, it's like, heck, it could be like more of the gut related, because you're talking about all that stool and crap that is stuck in your gut. And well, what is all the things in your pelvis? Like, we're pushing on the low back, we're getting, all the different functions of our body. And, and I hate the fact that I hate when people say, oh, I've been like this forever. Like, this is I've been dealing with gut issues, way back in my teenage years. And it's like, okay, but let's address it, because it's just going to keep compounding year after year, right? And you're going to start developing all these different medical to it's like, there's ways to kind of like peel back the onion and try to help heal your body. So I just hate when people...
Does it bother you? Like,
yeah,
it
it's
affects
just like
your day to day.
Yeah, but it really affects a lot of things. And, just even like lymphatic health, that's how we eliminate things. And if you're so blocked up in the gut, your lymphatic system is not, working. And, that's where a lot of our immune function is. And then we're getting sick. It is truly the foundation of our health. If we're not pooping and we're not eliminating the toxins and supporting our gut health, the rest, there's going to be so much that's going to come into play as we get older.
And you bring up a good point. I think there's so many people out there that have no idea what it means to live optimally, or to feel that, what it feels like to
they just
to live
accept it.
optimally.
Like, this is just how things are.
Yeah. Especially as people get older, they're like, well, this is part of the process, and they are resigned. And, it's interesting to hear not only us, but everybody in this integrative wellness coalition talk about, we're giving you a pathway to better. walk through it, right? I mean, here are all of the tools and the strategies. Reach out to any one of us and we can help guide. I'm going to flip this. So we talked about IBS-C, the constipation. Let's flip it around for those with maybe urgent loose stools, so the IBS-D, the diarrhea dominant. What are your top interventions, things to rule out? Let's have that conversation.
Yeah, definitely first and like foremost, right, is going to be like the neurological like brain signal, right? Like, cause some people will definitely say, oh, like I notice an increase in my bowel movements, or I notice more loose stools, like when I'm anxious or nervous or like agitated. So that's a huge component of it. But we're talking like, I'm thinking like, yes, IBS-D, where it's like pretty consistent and it really doesn't have a lot to do with like fluctuations in anxiety and mood and things like that. That is where I just kind of mentioned it's more of a dysbiosis thing in your gut at that point. So again, and when we think of our exposure, you're just getting an imbalance of bad microbes in your gut compared to your good ones. So we have to bring those back into alignment. But some of the good tools, like even if you are experiencing like chronic loose stools, is like get yourself like a bulk forming fiber at that point. That's good. That obviously that's not good for someone who's constipated, right? Like that's why you have to be aware that like using like Metamucil or something is not going to help you if you're constipated, because that's all they tell you is like, oh, just drink more water. And right, they don't talk about drinking water smarter, which we had a whole episode on that, on like the minerals and the electrolytes and stuff. But then they just tell you to add more fiber, which is actually not beneficial for someone who's constipated, because they need definitely more like soluble forms of fiber, I would say. Okay, like apples and like chia seeds and stuff like that. But on the opposite spectrum here, like you can get more of a bulk forming fiber. So that generally comes in the form of like something called psyllium husk. And you can get that at the grocery store, and you can put like a tablespoon, 1 to 2 tablespoons in water and drink that like after meals. So that like if your bile is being released, it's going to be more binding, to some of the stool going through, and it's just going to kind of slow things down, bind it up. But then, yeah, often at that point, I'm like, okay, we actually need to adjust some stuff in the microbiome. And I find that like there's some stronger like prebiotics that actually help more with loose stools, and stuff that targets more small intestinal bacterial overgrowth. Those are the primary 2 things I'll usually try to get on board for a little bit and see how people do with that. Like if they use a certain product for like a month or something like that. Again, for me, it's more like prebiotic focused when they're dealing with loose stools, and then there's some more different products for like small intestinal bacterial overgrowth. And then something I also use too, between meals on an empty stomach, I tell people you can get a binder. So like low dose, like activated charcoal, or like bentonite clay, or the other ones, they do have like pectin and things like that, where it will bind up some of those loose stools, and then which could bind up toxins and things like that and help it be eliminated from the body. But yeah, just at that point, it's more like bulk forming fiber that's going to be more beneficial. But if it's consistent chronic loose stools, you can almost guarantee you got some dysbiosis going on, and that needs to be addressed, or it will never stop or kind of slow down. And a lot of people had said that when they had gotten like norovirus or something like that, where it came in and you could easily tell it disrupted your normal gut flora, essentially.
Right. This is when I think about people that are struggling with IBS-D or diarrhea, or even just the urgency around that. I will say high intensity workouts really are not your friend, or those long endurance workouts. This is an opportunity if you are experiencing an IBS-D or just diarrhea, or more urgency around going to the bathroom, that those long endurance sessions or those high intensity workouts, probably a good time to pull back on that a little bit, and concentrate on restorative movement and breath work and some light strength work maybe first, and then bring that back into balance first. Are there specific exercises or physical patterns that you found helpful for clients with gut issues, things that people can try at home?
I know, like mobility wise, I do teach individuals with constipation how to perform like a gut massage, for the colon. So I do teach them how to kind of help soften and help move that. The deep breathing is such a huge one. Anything to kind of open up the pelvis. So I love getting people on a big, exercise ball and even just sitting on it and kind of rocking their pelvis around side to side in circles just to kind of help open up that pelvis, just to kind of get things moving. And a vibration plate, which I know we've talked about. I love the vibration plate for your lymphatic health, but that vibration really does help propel some of that stool as well. So, I definitely throw in those little tips to see if that'll help kind of move some of the gut along.
For sure. I think just a quick, simple flow. If you were to do some cat-cows, some child's pose breathing, and a quick walk around the house, a lot of times that's the combo that gets that diaphragm moving a little bit more. It mobilizes the spine. It starts to, it encourages movement of the food throughout the system without stressing the system, which is not something that we want to do.
Yeah, I appreciate what Lindsay said too, just about like getting the mobilization too, because I was like over here raising my hand. I'm like, okay, the cholecystectomy, the surgeries, laparoscopic surgeries from endo. I got a lot of those, and I have scar tissue, and I don't get frustrated with it anymore. Like I realize, like if I'm having a little bit of digestive issues, like I'll get on the floor and do a little bit of this mobilization. Like I'll lay flat on the floor and actually just stretch my body out fully. And then I've had people show me the visceral techniques to use, and I will pull kind of in the scar tissue area to release in certain points, which has tremendously helped me. And then that just kind of loosens things up, and then things are able to flow, and you can feel it. You can feel like your fluids and everything start to go through at that point. And then I'm definitely a huge fan of the kind of hot and cold therapy, because like getting in the sauna really helps get blood flow to the organs, and then it's like I'll do like I don't do like full on cold plunges and stuff. I like to use a little bit of the cold shower technique, where like at the very end of my shower, I'll just like for a minute or 2 minutes I'll sit in like the cool water, which again, those tactics, they vasoconstrict and dilate, which helps blood flow and everything move to your organs. So it's just a nice little tool like that you can use at home as well. And again, heating pads, right? And we talked so many times about like castor oil packs and how that can really help with constipation, because again, you're driving heat in that castor oil to kind of detoxify the liver in that area, which helps with bile flow. And usually people have a good bowel movement in the morning.
Yeah, for sure. As we wrap up, I want to give each of you the chance to share one more thing that you wish more people knew when it came to gut health and motility. If you were to give them one thing, what would it be?
Well, I think just going back to the fact that like this doesn't have to be like, this is not have to be normal for you. Right. Yes, you may have been dealing with this for years and years. You don't have to accept it. And it's, definitely, peel back the onion and just try to figure out, try a couple things and reach out to us professionals if you need that little extra assist, or where do I start? Right.
Mm-hmm. Yeah, and I would just say if you're not happy with this label of IBS, there's definitely more root cause strategies that we can help you with, and it doesn't have to be your norm or the norm. We can absolutely provide you strategies to help your body.
Those are great takeaways. Gut health can feel overwhelming, but it doesn't have to be. So again, reach out to the professionals, reach out to anybody in the Integrative Wellness Coalition. We'll put a link to some of the providers in our show notes. As always, thank you both for being here. Thank you for listening. Hopefully this episode gives you some real tools, some real insights, and a reminder that if you're dealing with one of those two things, you are not alone. If this episode was helpful, share it with a friend. Please hit the subscribe button. We are on Apple Podcasts, Spotify, wherever you get your podcasts. Leave us a review. Also, don't be afraid to send us topics that you would like to hear more about at info@theintegrativeedge. Did I get that right?
.com.
.com. All right. And join the growing community. So thank you so much. We'll see you next time.